My name's Maria Early. I am a student with Herzing University for the Nurse Practitioner program, and I'm going to be performing a head-to-toe assessment on a patient for our health assessment class. So I will walk into the patient's room, introduce myself. Hi, my name's Maria. I'm a nurse practitioner student with Herzing University, and I'm going to be performing a head-to-toe assessment on you today. I'll go ahead and wash my hands and come back to the patient. Are you comfortable?
Yes.
And you're warm enough right now?
Mm-hmm.
Okay, and so I'll make sure I protect her privacy and make sure she's comfortable. And then introduce myself. So I'm Maria, and I'm going to be performing a head-to-toe assessment. Can you tell me your name?
Natalie.
Okay, and can you tell me why you're here today?
I'm getting a physical.
Okay, and are you getting a physical for your sports, so you can play sports at school? Yes, okay. So Natalie's here today for a sports physical. What sports do you like to play?
Basketball, volleyball, and softball.
All right, so you're pretty active, aren't you?
Mm-hmm.
Well, good. The other thing we need to go through is her history, and so do you have a past medical history of anything? Like, have you been in the hospital? And have you had any surgeries? Okay. Have you had any problems with your lungs or your stomach or your heart, kidneys? Okay. Any problems with your joints? Any pain anywhere? So Natalie's a pretty healthy little girl. Any problems with your eyes or headaches? Okay. And how about your hearing? It's good. Yeah. All right. Natalie's mom has marked on her intake form that she's had all of her vaccines, and she's up to date on that. Can you tell me what grade you're in?
7.
Okay, so her last vaccines were in the 6th grade, so she's good on that. And then, do you think you've had the flu shot this year?
Yeah, I think so.
Okay, so she's up to date on her flu shot. That's good. That helps protect us from the colds and flus that go around, and then it also helps us stay safe around other people so they don't get cold or flu. So the other thing is, do you take any medications?
Allergy medicine.
Okay, so Natalie takes allergy medicine, so in her past medical history she would have allergies listed as an issue. As far as her social history, do you smoke? All right, do you drink? And do you vape? And do you use alcohol? Okay, so that's good also, Natalie. And then talking about for her age, it would be appropriate to discuss that she shouldn't be drinking and no smoking and no vaping. And you understand that, correct? Very good. In her family history, she doesn't have any family history, no heart disease, no lung disease, no cancer, no diabetes in her family. Natalie doesn't have diabetes either. No stomach problems, no anemia, no history as far as her family goes. So Natalie, I think we'll go ahead and start. Can you tell me how much you weigh?
103.
Okay, and then how tall are you?
5'3".
Good. So another thing we can discuss for her social determinants is her weight. So I have a BMI table here. And so when we look up Natalie's height, it's 63 inches, and when we look up her weight, it's 103. She's just a tiny bit under normal BMI, so it's important for you to eat healthy meals and get some exercise and maybe try to increase the things that you eat during the day. The other issue to talk about is Natalie does have health insurance. Her mom paid a copay prior to her appointment, and she does obviously have access to health care, and that's not an issue for Natalie or her family. So to continue on, we will get Natalie's blood pressure. Go ahead and put this on. Make that kind of tight there. All right, I'll have you turn your arm around here. We'll kind of pump this up. All right, that's good. Natalie's blood pressure is 106/68, so that's within normal limits. The next thing we'll do is get her pulse. And we can take this for a minute, but for purposes of this video, we'll go ahead and move on and say that her pulse is 16. And then the other thing that we'll watch while we're getting her pulse is her respirations. So we'll say respirations are 80. So 16 and 80, 106/68 for her blood pressure. I don't have a thermometer with me, but we'll say for her temperature, it's normal at 98.6. And then the same thing with the pulse ox. Natalie should run, 98% to 99% on room air. So I think that will do for that. Okay, Natalie, so let's go ahead and start then with your assessment of your head. And we'll look at Natalie's head and hair. It looks good. Her hair's brown. Do you have any lumps or bumps anywhere? Any sores? Any tenderness while I'm pressing on you? Okay. So her hair's well distributed, and I don't notice like any dandruff or any little nits or bugs or lice or anything like that. So we'll go ahead. Looking at her head, it's the normal size for the shape of her. It matches with the size of her body, and it's even, and she's normal cephalic. So while we're here, Natalie, we're just going to go ahead and press on your frontal sinuses. Tell me if there's any tenderness. Any tenderness? No. And then we'll go ahead and press on your maxillary sinuses. Any tenderness there? All right. No tenderness there. The other thing that we'll do right now is check her lymph nodes. So we'll feel for her occipital lymph nodes, her pre-auricular lymph nodes, her post-auricular lymph nodes, post-auricular lymph nodes, pre-auricular lymph nodes, her tonsillar lymph nodes, her submandibular lymph nodes, her submantle lymph nodes, move over to her posterior cervical lymph nodes, her anterior lymph nodes, and then her supraclavicular lymph nodes. None of those feel enlarged. Any of those areas tender or painful? Okay, so all of Natalie's lymph nodes up in that area are good. The next part we'll do is we'll go ahead and move to her face, and her face looks good. We'll check her trigeminal, cranial nerve 5, her trigeminal nerve. Can you go ahead and clench your teeth? Okay, and feeling back here, it's nice and strong. Can you close your eyes? And I'm going to rub something across areas of your face, and you let me know when you feel it, okay? And then tell me where you feel it.
On my head.
Okay, and then here. Okay, and there. Good. And down here. Very good. So cranial nerve number 5, her trigeminal, is intact. We'll test her cranial nerve number 7, which is her facial nerve, and that, can you puff your cheeks? Okay, and can you raise your eyebrows? Good, and can you smile? And can you frown? Okay, so cranial nerve number 5 is intact as well. All right, Natalie, we'll go ahead and move on to your eyes. And I think the first thing that we'll do with your eyes is check your acuity. And this is cranial nerve number 2. So the first test will be hold this out, arm's length. Is that about arm length for you? And I'll hold on to it now. And you cover one eye. Okay. And can you read?
D-E-F-C-T-O.
Okay, how about the line above it?
F-E-L-O-P-D.
Okay, so Natalie's about 20/30 in her right eye. Okay, now cover your other eye.
D-E-F-P-O-T-E-C.
Okay, and she's about 20/20, or she is 20/20 in her left eye. Now both eyes.
D-E-F-P-O-T-E-C.
Okay, very good. So Natalie is 20/20 with both of her eyes. The other test we can do to test optic nerve 2 is to test her peripheral vision. So I'm gonna come from behind. And let me know when you see my hand in your peripheral vision. Okay, and I'm going to come from the other side. Okay, and then from the top. Okay, and then we'll come from the bottom. Look at me. Okay, so our peripheral vision is good, and cranial nerve number 2 is intact. The next thing we'll do with her eyes is take a look with the ophthalmoscope, and kind of a bright light that I'm going to shine into your eye, okay? So just look ahead at me. All right. And the blood vessels look good, and there is a red light shown. And looking at her other eye, look straight ahead. And I don't see any blood vessels either in that eye. And I see the red light reflex as well in that eye. The other test that we'll do right here is with a pen light to check for her restriction or her constriction of her pupils. The other thing with her eyes right now is the conjunctiva is pink and it's moist. It's not, there's no drainage in both eyes. And can you look up? Her sclera is white and it looks good as well, and there's no discharge. Her eyebrows are nice and equal as well, and she has eyelashes. So what I'm going to do here is bring this light in and see about her pupils constricting. So the left one constricts. I'm going to go back out. I'm going to look at the right one and see if it does the same. The right one does the same. We'll come from this side again. The right one constricts, and we'll go to do it again, check on the left. The left constricts as well. The other thing we'll do is follow look at my pen, follow it in, and check that. That checks accommodations, so her eyes are, her pupils are equal, they're round, they react to light, and they accommodate. The next test we'll do is to check cranial nerve 3, 4, and 6, her ocular nerve, her trochlear nerve, and her abducens. And the test we can perform to check to see if that's intact is the H test, which will test the 6 cardinal fields of gaze. So Natalie, look over here. I'm gonna make like an H, just follow it with follow your eyes with my finger. So we're gonna go up, and up, down, come back across, up, and down. So as far as any extraocular movements, Natalie is good, her eyes look good, and they move and perform the way they should. The other thing, then we'll just move on to your ears. So I will change my ophthalmoscope. And I'll switch it out to the ear, making an otoscope. Okay, so that's good. We'll take a look at Natalie's ears. Her external auricles look good. External auricles look good. They're dry. There's no drainage. She does have some piercings in her ears, but there's no drainage. Any pain? Okay, so her tragus is good. No pain in the back. I think while we're here, we'll go ahead and feel for the temporal pulse or temporal artery. And those are good and strong and equal. I'm going to go ahead and take a look in your ear. So I'm going to pull back on it. Take a look. Her tympanic membrane is a pearlish gray and it's shiny. There's no drainage noted, no extra fluid. There is a little bit of cerumen. We'll take a look in this other ear. Pull back. Take a look. The same thing in this ear. Her tympanic membrane is a nice gray, pearlish, and it is shiny also with no drainage. Okay, the nerve test that we will run here is cranial nerve 8, her vestibulocochlear nerve, and the way we'll test that nerve is by the whisper test. So what I'm going to do is cover this ear, and then I'm going to whisper some words, and you repeat what I say. 1, 2, 3.
1, 2, 3.
All right, and cover this ear.
4, 5, 6.
Okay, so cranial nerve 8 is intact. The next test we'll do is the Renee test. I have a tuning fork here. We will I'm going to make this hit this. I'm going to put it up against your ear, and you let me know what you hear. And these tests, the Renee test and the Weber test, they test her air and bone conduction with her hearing and identifies if she has any hearing loss. So I'll go ahead and hit here. Let me know when it stops.
Yeah.
And then up here. Okay.
Yeah.
Okay.
Yeah.
Okay. So that's good. And then we'll do the Weber test. I'm going to put this on top of your head and then let me know what you hear. Well, and let me know if it's in middle or right or left, or is one stronger than the other.
Middle.
Yes. Okay. So that test is good, and her hearing is where it needs to be. All right. We'll take a look at Natalie's nose. Her nose is midline. It's even with her face. Have you ever broken your nose or done anything with your nose? Good, it looks good. She doesn't have any drainage or any problems with it. We'll take a look up your nose. And both sides look good. They're pink and they're moist. The turbinates are not swollen, nor are they boggy. They look good. A test that we can do to test cranial nerve 1 is going to be the smell test. That'll test your olfactory nerve. So I'm going to put something in front of your nose, hold one side, and then let me know what you smell, okay? So go ahead and close your eyes and hold one side of your nose. Okay. Take a smell.
Alcohol.
Okay. Cover the other side.
Alcohol.
Okay. Very good. So olfactory nerve is intact and good. Okay, from here, we'll go ahead and move on to your mouth. So, we'll use this light again, and we'll check cranial nerve number 9, which is the gag test. I'm not going to test Natalie for the gag reflex, but that's her glossopharyngeal nerve. And then the other nerve here that we can test, put out your tongue and say ah, ah, ah. And her uvula rises, it's even. And so that's her vagus nerve, cranial nerve 10, and that's intact as well. While we're here, we'll take a look at her tongue. Her tongue is nice and pink, it's moist. We'll look at the insides of her mouth. Her buccal mucosa is nice and pink, and any sores or problems in your mouth. I'll take a look at your teeth. Go and put your tongue in. So her teeth are good. Any problems there? Okay, she does have some fillings in there, and she does have some braces. Raise your tongue. Good. So there's no sores underneath her tongue. Go ahead and stick out your tongue. We'll test cranial nerve number 12, her hypoglossal nerve. Stick out your tongue now, side to side. Good, and that's intact as well. Her lips are pink and moist, and there's not any problems with those. So, we'll move on to your neck. So we'll feel around. Her trachea is nice and midline. Feel for her carotid pulses. Those are nice and strong and even. Look for jugular distension, which I don't see any. Go ahead and swallow. And that feels for her thyroid gland, which she has no problems with. We'll also listen for any carotid bruits. And take a breath and hold it. Okay. And let's try that again on this side. Take a breath and hold it. Okay, and that's good on that side. So, no bruits are heard there. We'll check the cranial nerve number 11, which is her accessory nerve. So go ahead and shrug your shoulders, and those are intact. You're tired? Go ahead and turn your head this way. That's nice and strong. And turn your head that way. That's nice and strong as well. While we're here, go ahead and raise your shoulders up. Good. Can you put it behind your back? Nice. Out to your side. Good. And then go ahead and out to front. Good. And then let me go ahead and pull up. Okay. Her strength in her shoulders is nice and strong. We'll also do the range of motion of your neck. So head down to your chin. Yeah, chin down to your chest. Head back. Good. Side to side. Lateral movement and rotate. Rotate. And the rotation of her neck and range of motion of her neck is good as well. We'll go ahead and move to your heart, and we'll listen to her pulse. We'll look at her chest is even, it's symmetric. The precordial area is good. We'll go ahead and listen. We'll do some palpation and percuss. We'll listen first. And I'll just listen to your chest right now. So the aortic valve, the pulmonic valve, Erb's point, her tricuspid, and then her mitral valve, and then while we're down in this area, we can check the apical pulse, and that's even and normal with the pulses felt in her identified earlier. The other thing about her heart sounds is her S1 and S2 are heard and normal. We'll listen for some murmurs. So aortic, pulmonic, Erb's, tricuspid, and mitral again. And all of those sound normal. All right, if you can sit up straight again, sit up straight, we'll go ahead and percuss. See if there's any areas of air. All right, and no pain anywhere, right? Okay, kind of palpate around, nothing. Okay, and then while we're here, let's go ahead and we will check for tactile firmitus. So say 99, 99, 99, 99, 99, and that's good. There's no vibrations felt. And then we'll go ahead and listen to her lungs while we're in front. So take a deep breath. Deep breath again. Good. And a deep breath. Good. And a deep breath. Good. A deep breath. And deep breath. And a deep breath over here. Okay. And all of our lung sounds sound good there. We'll go ahead and move around to her back. Yeah, you can still see me. So we will feel on her back, feel for any tenderness, no tenderness. Anything on your spine? All right, no, nothing there. So her spine feels good, there's no pain. Go ahead and percuss on your back. That's good. We'll do the 99 test again. So say 99.
99.
And 99.
99.
99.
99.
And 99.
99.
Good. I don't feel any vibrations there. I'm going to test her costovertebral angle, see if there's any pain there. So I'm going to, you'll feel a little pop and tell me if there's any pain. Anything? Okay. And another one. Good. Okay. So all of that is good. We'll go ahead and listen to her lungs back here. Take a deep breath. Good. Take a deep breath. deep breath. Good. Deep breath. Good. Deep breath. Good. Deep breath. And one more. Good. And one more over here. Good. So her lung sounds in her back are good. And the posterior part of her lungs are great. Before we have you lay down, let's test your elbows. So I'm going to look at her hands. Obviously her fingers pop fine. They move fine. Any pain there? No? No pain in your fingers? Can you put your fingers together? Yep. That looks good. So that's good in her range of motion. Her capillary refill is good. It should be under 3 seconds, and it is. They're nice and pink and they're warm. Her skin on her arms is good. Her skin all over her body is good. It's nice and warm. As far as the trigger goes, there's no tinting in her skin. No sores noted anywhere. Everything looks good. So we'll go ahead and feel her pulses while we're here too. Radial pulse is good. Radial pulse is good. Brachial pulse. Feel it in the other arm. Those are nice and strong and 2+ on both her brachial and her radial nerves. Go ahead and raise your elbows up. Range of motion, so flexion. Go ahead and straighten them out. Extension, that's good. We'll move around your wrist. Nothing with your wrist. Your wrist good. Okay. Go ahead and put your elbows up. We'll test your strength. I'm going to pull against you. Okay, and then you push. No, keep your hands turned. No, go ahead and push against me with your elbows. Yeah. So that's strong. That's 5 out of 5. That is good and nice and strong also. Okay. I'm going to go ahead and have Natalie lay down. Got it? Okay. So we'll go ahead and take a listen to her stomach. We're going to feel your stomach a little bit, see if there's any tenderness anywhere. We'll take a listen to it and then move on to the next thing. Natalie's stomach is flat, it's dry, it's warm, the temperature's good. The respirations, you can see her stomach rise and fall. Do you have any pain or tenderness in your stomach? So we'll go ahead and listen to her first. Her bowel sounds are positive in all 4 quadrants. We'll listen for some bruits, so her aortic, her left renal, no, her right renal, her left renal, right iliac, left iliac. All of those are good. No bruits are heard. I'm going to go ahead and just kind of press on you lightly. Tell me if there's any pain. Any pain? No. All right, now we'll go a little bit deeper. Any pain? We'll go across. No pain still? All right. No pain. Then we'll palpate for her liver. Take a deep breath. All right. And then we'll palpate over here for liver. All right. Check her kidneys. No pain anywhere. All right. We'll do, we'll percuss. Those areas are tympanic. We'll try to find her liver span. So we'll percuss from the top. normal liver span is 6 to 12 centimeters. Natalie's measures about 6, so that's good as well. We'll go ahead and feel her femoral pulse while we're here. Feel on the other side her femoral pulse. That's 2+ as well. We'll feel in this area any tenderness. Feel in the other area, no inguinal nodes are felt. We'll go ahead down and do a range of motion of your hips. So I'm going to raise your leg up. We'll go external. Tell me if there's any pain. External rotation, internal rotation. Good. Okay. Raise your legs up, up. External rotation, internal rotation. Is that good? Okay. We'll feel her pedal pulses while we're here. Those are nice and strong. And our posterior tibial pulses. Those are nice and strong as well. Bilaterally. There's no edema in her legs. They're nice and warm. There's no sores on her legs anywhere. She's actually holding her legs up. Her legs are real strong right now. Can you wiggle your toes? Good, wiggle your toes. I'm gonna move one toe up and down. Tell me whether you feel up or whether you feel down.
Up.
Okay.
Down.
Okay.
Up.
Good.
Down.
All right, that's good. Okay, let's go ahead and have you sit up. Be careful hopping up. And we'll have you scoot back around this way. Okay, let's go ahead and extend your leg. So we'll check her knees and then bend them. Those good. And then this one, that's good, good. We'll do your ankles, dorsiflex, plantar flex. Let's do the other one, dorsiflex, plantar flex. Go ahead and push against that's strong, and then push down against it. That's nice and strong. Push up, good. Push down, that's nice and strong. Same thing here, press here. Good, that's nice and strong. We'll check some of your cerebellar function right now. Put your hands on your, like flat on your hands and flip across fast. That's good. And then arms out. And you're gonna go side to side. Very good. So those things are good. Let's go ahead and test your reflexes. So we'll test the tricep reflex, and then we'll test her biceps. Go ahead and turn your arm around. Okay, and then brachioradialis. Put it down here. Okay, and then we'll test on the other side, triceps. And then brachial. And no, that was her biceps, sorry. Biceps, then brachial radialis. All right. The other thing we'll check while we're here is her epitrochlear nodes, and there's none felt there. Those are good. We'll go ahead and test your patellar tendon. Those are intact. We'll do the Achilles tendon. Nice. And then also we'll test her Babinski. And those are good.
Oh, but that hurts my feet so bad.
The other test we'll do to test for sensory is I have a dull and a sharp object. So let me know, this would be the sharp, and this is the dull, okay? So go ahead and close your eyes. Tell me what you feel.
Sharp. Sharp.
Okay, go and put your arms out.
Sharp.
You can just set them down here on your side.
Sharp.
Okay.
Dull. Dull. Sharp. Dull. Dull. Sharp.
Go and uncross your feet.
Sharp. Sharp. Dull. Low.
Good. And those are good. Another test we can do for to test for sensory is the stereognosis test. So close your eyes, and I'm going to put an object in your hand and tell me what you feel. This hand.
A quarter.
Very good. And I'm going to put another object in this hand and tell me what you feel.
A marker.
Okay, and that's correct. You can go ahead and open up your eyes. That's good. Okay, so let's go ahead and have you stand up. Be careful, yeah. We will inspect her spine. So can you bend over and touch your toes? She can touch her toes, and again, her spine is nice and round. It looks good. She's good. And no tenderness anywhere, right? Okay, go and stand up straight. And so her flexion's good. Can you extend your back? All right. And go side to side, side and side. And then can you rotate? Good. Rotate. Now go ahead and walk towards the camera. We'll check her gait. And then go ahead and walk back to being on your heel. Well, that's okay. Now turn around. We'll do heel toe towards the camera. Okay. Yeah, go ahead. No, heel toe. Good. And then come back on your tippy toes. Good. Those are good. And then one of the last things we'll do is the Romberg test. We'll put your arms out to the side and close your eyes. And we'll see if there's any swaying. And we'll check that for about 20 seconds. And Natalie looks good. All right, and you can go ahead and have a seat up here again. A couple of things that I think I forgot was probably the most important at the beginning was asking her if she knows where she is. Do you know where you are?
Yes.
Where are we?
At the hospital.
Okay, and do you know your name?
Natalie.
Okay, and what year is it?
2019.
Okay, and then who's the president?
Trump.
All right, so Natalie is alert and oriented to person, place, and year, and context, alert and oriented times 4. And then another thing that we need to check is her temporal mandibular joint. So go ahead and open. All right, and close. So no, there's no popping or clicking felt there. Is it tender at all? No. Okay, so do you have any questions, Natalie? All right, well, if you don't have any questions, I think we can end this exam, and I appreciate you coming in and helping me out, and then we will see you back in the office in a year, okay?
Okay.
All right, thanks, Natalie.
You're